Systems is something that's big, taking time to create the systems and also, editing the systems. I think a lot of people think that one time I can set up a system and everything's going to flow. It's not. It's going to change as you grow. You had 4 employees back then when you started this system. Now you have 20 or maybe you have 10, and things need to change. People need to have accountability. So every time you hit new milestones, you have to think of new challenges, whether you have them come right to your face or whether they're coming in the future. Prep for those solutions and prep for those systems.
Welcome to Healthcare Marketing Edge, where we share stories and strategies to grow your practice. I'm Team Bouchard from Luminus, a healthcare marketing agency in Buffalo, New York that specializes in helping practices acquire patients and grow their practice. Today we're talking about improving patient outcomes and running a more efficient operation, and what you can learn from someone who's seen dozens of facilities do it well and some do it poorly. Our guest is Nicholas Messina, COO at Gabby Health. Because Nick works across so many skilled nursing facilities, got a rare view into what actually moves the needle on outcomes, how teams adopt new tools without panic, and why the strongest operations tend to win business without chasing it. Whether or not you're in post-acute care, there's a lot here for any practice owner or marketer to learn from. Nick, welcome to the show. Why don't you tell everyone a little bit about who you are and what you do?
Hey, I appreciate it, Tim. Thanks for having me. It's so awesome being on a podcast that really be able to share and drive value, because we see so many podcasts out there and it's just nonsense. So this is great.
Yeah,
I actually,
this is awesome.
I was looking into your podcast and a lot of really good speakers. So I'm honored to be here. But I'm Nick. I'm with Gabby Health. We operate in multiple different skilled nursing facilities and then also in the ALF world across multiple different states. We help lower rehospitalization. That's our goal. And we're owned and operated by 2 different providers. Our ultimate, MO is that we love to service patients and keep them out of the hospitals.
Cool. And now you have a lot of different skilled nursing facilities. What separates, you work with all sorts of them. What separates the ones that improve outcomes and run efficiently from the ones that might struggle?
Yeah, I think it really comes down to providing them with the right technology so that way they can understand their patients. The more data that you have on your patients, the better outcomes you can actually create. The knowledge that is built behind that is phenomenal.
And as a COO who kind of sees both the operations side and the growth side, what do you notice that most practice leaders miss when they're like doing their thing, right? They are owners, practitioners usually at the same time. They are very skilled, very knowledgeable in the healthcare wellness practice, but sometimes, they're also on the business side. They're the practice owner too. What do you think they're missing right now? That kind of how, operations blends into that growth side too. So you have to consider that as well.
Yeah, I've seen this in many different industries. I've been in quite a few different industries, and it's really just being able to use the tools that are around you. There's so many different things, and I think everybody gets scared about AI. We're kind of slowly getting over that burden, but AI is not here to replace people. It's really here to, help your workflows, improve your workflows, and give you access to things that you couldn't really necessarily get access to before. So, we deal with a bunch of different nursing homes, and one of the tools is just like one out of like the 8 tools that we give them is an admission tool. And now some admission people inside of skilled nursing facilities, they may look at that as, something that goes against them, because it's analyzing 100 discharge summaries and it's spitting out the exact breakdown of what they're looking for. Some people are like, oh, well, that's going to replace my job. No, it's not going to replace your job anytime soon. But what it will do, it will speed up your workflow and allow you to not to miss things. Same with practice owners. If you can have a report exactly what you're looking for, speeds up your efficiency. And number 2, you can actually get back to that more thing that you love, which is patient care. I tell people this all the time. Use technology to your advantage, so that way instead of having your butts in seats, you're at bedside with the patients, understanding their needs and giving them more of that time. I think any practice, any doctor, they want to kind of rush through an appointment or rush through seeing a patient, because in the back of their mind they're thinking about all the documentation they need to do, the right follow-ups. It's giving that peace of mind of like, look, that stuff's going to get done, and I can focus more on having that personal touch. And that's why they signed up for this.
Yeah, and that's a very outcome-driven message too, right? So, in terms of growing things, and we talk about this on the patient-centric marketing side for practices all the time too, is that if you go towards the outcome and the end result and work your way back from a messaging and value prop standpoint, it adds more meat and value to the conversation. It gets the attention better than other messaging that's a little bit more, bullet pointy or anything like that. And practice owners are decision makers too, practitioners, and you're working with and reaching them with messages too. Like, how important is it for you to focus on that outcome-based messaging?
I think that what separates our business and like our approach is very from the beginning, right? So we do a lot of oversight services. So we do a program called chronic care management and remote patient monitoring. Then we combine that with some technology, which I just mentioned on the admission side, to kind of create this whole full solution. But there is many different companies that do one or two of the pieces, but they're not outcome-based services. They do something just to be able to bill. We're really looking for true outcomes inside of our business and trying to really lower rehospitalization, because there's a bunch of beautiful things that come with lowering rehospitalization. Obviously, higher reimbursement, you have less fines and less tags that you're going to get on your facility, and you're really going to have those results that you're looking for your team. So what really separates us is being that physician-led organization first. I mean, I'm very proud to be a part of Dr. Naboo and Dr. Neal's full vision of what this program is looking to be, and it's constantly growing. We've seen a lot of organic growth just by having that type of approach. It may not be as fast as everybody else wants to be, but I think in the long term, our goal is for us to be actually recognized from the payer source as an access model of like, look, you guys run a very productive service, and that's really where our end destination is trying to take us.
Well, the longevity of that sticking to is much better than just like a feature-rich pitch, right?
Mm-hmm.
Because you're giving someone something beyond the transactional benefit and also the outcome benefit there too. So that sticks with people, and that actually resonates with what you mentioned, vision. That resonates with their vision and their mission too.
Yeah. Yeah. And we see this all the time. I've seen this in, ALFs, where family members are a little bit more involved. And, when we tell them we're going to be running an oversight service, they love it. They love that extra line of support for their facility. If my mom was in a nursing home and I was able to sign her up for a chronic care management service where on top of the building, I have somebody else watching her charts, watching her vitals, seeing trends that are going on, that's an extra layer of support. So I think that the biggest challenge that we run into is for those buildings that don't really want us is usually because they're not really doing the right thing. I think everybody that if they have the right goals and if we talk to the right team members that want the correct results, we fly through. And again, our marketing strategy is a little bit different than most. We see this all the time, but I've seen many different practices run a CCM and remote patient monitoring service even out of their practice that can tremendously help their patient outcomes. And if you could provide that better service, they're going to continue coming back to you, no matter if you're a fee for service or not. So I've seen this program run tremendously, mostly through the United States. I think there's very few that run it the wrong way.
Now, you've mentioned AI. You mentioned the whole not taking your job thing as part of this too, right? Is that the only apprehension people have to AI? Are you seeing other things that are keeping people from jumping on to this sort of like value assist that can boost their operations?
Yeah, so I think Dr. Neal, hits this. She's an MD, but she also has an MIT background. She's actually the brains behind a lot of our services, growing her and our CTO rule. They've seen this kind of change, and they talk about this all the time, right? We were at that stage in maybe 2021, 2022, where everybody was afraid of AI. And then we kind of started to get over that hump. I think that every part of healthcare is adapting AI at this point. It's like the internet when it first came out. Everybody was afraid of it. No one wants to jump on it. I'm not putting my information out there. Now, I think a lot of more people are being adapted to it. So really, I'm taking the words out of Dr. Neal again. She sees the vision of AI where it will go to AI agents. And once they're AI agents, they'll be able to help more people with their daily tasks. The goal, again, is being proficient. I see, especially not even in nursing homes, but in private practices, where an AI will actually do some of the back-end analytics. Maybe they're taking the vitals, tracking the patient every time they come into the doctor's office, and then the doctor can kind of create those extra things. We've seen this in radiology. Why is radiology a dying career? It's because AI is looking through so many different things. And as humans, we have to come to the realization that we can miss stuff. There always will be oversight forever. Even in the very future when AI does a lot of different things, but we have to look at it in two different things. One, ethically, are we going to say that we are better than an AI, looking at something constantly? No. Number two is whether we want to adapt with it or against it. There's a lot of people that are talking about data centers and different things that are going around with it. There's always a positive to something. And we have to kind of take that accountability, right? You either grow or you watch something else grow without you.
And in terms of the actual like implementation of things like this, it's one thing for the provider or practitioner to buy into the idea of needing this, wanting to augment, implement this within their systems.
Yes.
How have you seen people bring full teams on board? Because you are fighting a lot of those micro battles as part of an implementation process.
I can't believe you asked this question. This is something that, we work with our team. We actually have implementation specialists, and, we have breakdowns of how implementation went. And this is the realization of the struggles is some of these facilities, skilled nursing facility, they are, more digital now, but the whole assisted living communities across the entire United States, a lot of them are just now switching to a digital service, right? And, they're doing a lot of paper stuff, paper vitals and different things, and convincing them, look, this is what's going to be better for the patient. Sometimes they look at it as more work, and, just education. Like I'm a big believer on, yes, you can get a lot of stuff done faster if you educate everybody at once. But how somebody's really going to be receptive to the information is you sit down one time with them. So we believe in one-on-one integrations and one-on-one coaching in this, because this is a problem. Just kind of showing people how to use technology. My dad, he's not good at technology whatsoever, but once you set him up with the iPhone, he's good with the iPhone for the rest of his life. Sorry, excuse me. So once we, really show people the way of how services work and coach them on that process, they do feel more comfortable with it. But like you said, it is kind of a hill to climb in the beginning.
Now, once they get these rolling, I'm assuming that it improves their systems too. So I'm assuming you've got some good examples, or you've seen the representation of systems that are really getting things done within these practices. Do you have any good examples or some success stories about something really improving when this is implemented?
Yeah. Absolutely. So we run, like I mentioned before, chronic care management, which is a documentation oversight service. And then we also do remote patient monitoring, where we'll actually monitor patients' vitals on, either some kind of device. We were able to catch multiple patients that were trending in the wrong direction. We've seen their baseline on our systems actually trend out in the wrong direction. We're able to create interventions prior. We strongly believe in proactive care instead of reactive care. That's kind of like our slogan and our motto. But, we've helped multiple buildings go from 4 to 5-star ratings. Those are what, the federal government says, hey, this is what you're doing correctly. They have a surveyor come in, and, we're proud about that. We've even had reaches out by, the payer sources, understanding, what we're doing. And this is something they're willing to pay for. Like CCM and RPM, it's a newer concept the past couple of years, but we're seeing a lot more people, be receptive to it simply because they are creating different outcomes. We're able to lower rehospitalization on an average rate of 28%. Not all, facilities are the same, but, it is a great outcome to be able to do that. But I think anybody can do this type of services if they lead with the right intentions. I think that, AI is something that everybody should really jump on and be receptive to it, whether that's some kind of AI in your current EMR. There's a lot of EMRs out there, like Point Click Care, Matrix Care, Simple Healthcare, all these different ones that are out there that are having these features. Just try them out. They're willing to give you guys access to it, and your team has to adapt at some point. Whether you guys adapt now or your competitors, one of you guys are going to be, left behind.
Well, you mentioned earlier about the idea of boosting a star rating and patient feedback ratings too, and think about that from two different perspectives too. If you can be more proactive, like you mentioned, and you still need the team to be able to act on that, right? You're spreading the wealth and you're moving faster because of the analysis. The boosted star ratings, you have two different sides of this. One is the public perception, which is brand recognition and preference in the market, and two, think about all the referral sources that are vetting you that you could build your business off of as well.
Yeah, yeah. I mean, we're really seeing this from two folds. Like, so one of the other programs that we do with hospitals is a TCM program, Transitional Care Management. And hospitals are even considering us for that, whether we, help them go on the transition back to home or, to another facility, simply because of our services we're doing out in the field. The way that we want to go with our services in the future is where hospitals look at our platform and say, which buildings are actually using Gabby Health? That's really where we're trying to connect with the hospitals, with the different systems. And yes, they will go to a certain point where it will be access model. I've dealt with a hospital that I don't want to mention their name, but CMS basically dropped a hammer on them and said you can only send your patients to these certain nursing homes because you have such a high readmission rate. They can't pay it anymore. So, when buildings get to that, or groups get to that, they're going to go with the real outcome-based services and people that are willing to adapt to those services. So there's so many little things that are going to be, contributing to this stuff that people need to come to recognize. Eventually, we will move to full access model services.
So you mentioned getting traction from other avenues that you've promoted too. So we've talked about messaging a little bit and how to package this outcome based and how we're implementing these in the systems. How have you also, thinking about practices too? How do you think about getting more traction in the market, and maybe having this operations boost and systems boost helps with that? But there's lots of ways to grow a practice, any business really, but a practice. What have you learned in your experiences in this role?
Yeah, yeah, absolutely. I've worked for many different companies and, helped scale multiple different companies to, zero to millions of dollars. And I think it's the kind of like the same thing from every company, right? Number one, right expectations leads to less frustration. That's what I strongly believe in. And number two is building something that you would actually use yourself. People want to know not if the product works, whether you believe in the product. That's what they truly are trying to see on a presentation or anything like that. They're like, do you really believe in what you're actually pitching? And, this is something that I've actually talked to, with Dr. Neal for quite a while about. She's told me about, and I had to really wrap my head around this process. And I told her straight honestly, I was like, look, if you're really telling me everything is in this service is packaged in and you just want to put it out there, we just need results. And as we have these companies and these groups and these buildings, improve their star rating, improve their, reimbursement levels, and we're starting to get that traction, it really comes from, providing best level of care. Everything else is second. That's in every practice, that you could possibly think of. If you want to grow, number one, take care of your patients in the way that you want them to be treated, and everything else will follow. That natural marketing everybody, wants to have, and they think it's a fantasy. It's really not. It will come. It will come. And the more that you push that and focus on that, everything else will just flow into this. And we've kind of seen that. We went from having 0 buildings on our platform last year to, being able to scale almost to 100 different buildings, having 8,000 patients nationwide. And even in our provider group, we have a small provider group down here in Florida. We've helped, grow that tremendously just because everybody wants us. We're featured in little magazines here and there too. So everybody's like, how do I, join that group? How do I have that as my doctor, my provider? And it's simply because, they're able to hit these, these marks, these accomplishments, with lowering rehospitalization, providing the best level of care possible, and, really taking care of their patients. I'm so proud to be a part of this team.
Yeah, and that's the type of thing that will naturally also reach beyond you too. If you develop the reputation carries. And if we want to take another angle from AI into this too, and I bring it up often on the podcast, is if your reputation can spread without you actively putting it out there. I mean, you have to participate a little bit too. It will help in things which, search online, whether it's through the chats or whether it's through traditional search is still heavily reputation and citation based. So if you have good reviews, you're going to show up higher in map pack clusters, or you're going to show up higher in recommended chat responses. If you have more articles out there, you participate with your news stations, whatever it is, right? So mission driven means also helping in the community and spreading the knowledge of your care approach, and reaching the people that you want to work with. So I think, that's important here too. And what you're talking about is kind of playing the long game and not just playing the shortcuts, really.
Yeah. Yeah, it is. It is. And we're trying to go that route. Maybe we're not having the as much growth as everybody else. I heard Grant Cardone say this, saying, if you don't know me, you can't do business with me. And I understand that. And that's the goal, is to get your name out, but let everything kind of flow. I think everybody, nowadays wants that instant gratification. It's not always going to happen like that. Especially me, I've been a part of many different groups that move very, very quickly. And it was fantastic. But at the end of the day, the slow and steady, that's what really wins the race. And, people joke about it. They're like, oh, sometimes you have to be the aggressor. Not all the time, not in this industry. I think especially in healthcare, it's about providing the best level of service. There's multiple different medical devices that are out there that just try to rush to market. Maybe they get this one piece FDA approved, and they miss out on all these other things like integration, pushing data, and different things. So I think that slow and steady wins the race, and whoever's has that real mindset of like, this is the best level of care I possibly can give, will really dominate the market. And we're going to see that kind of separate. Every AI will kind of close the gap between a lot of different practices and groups, but it will also kind of separate from who's actually doing the outcome-based services.
Yeah, I think one thing that you were talking about too is if you go too fast, a fast rise can also lead to a fast fall. You can overplay your hand sometimes, whether you're marketing too much or you're growing too fast. If you can't do the operations and fulfillment on the back end, whether you're a systems or software or a provider, and simply you can't manage the patient census that you have coming in, the volume's too high. You end up back in that like negative feedback cycle where your ratings will start to dip, and then your reputation starts to dip, and then your referrals might pull back a little bit. So, sometimes rapid growth is not always the answer, and sometimes it is playing the long game, building off of strengths, building the reputation first, and then you can push the envelope a little bit when you feel comfortable with it.
Yeah, yeah, yeah. And that's the thing that, we struggle with, is like, we get signed contracts and, we want to create implementation, but we kind of are trying to pace it out on the right perspective to make sure we can fulfill those needs that we're talking about. Because, when you're talking about patient level of care, it's not something you can play around with. You don't just start it just because you can start it. You have to start it when you're clinically ready and making sure your back-end team is ready to take on those challenges. So, those are some of the things that we face. I would say that was probably the biggest thing that I face, is trying to grow into new states and new markets. And it's like, hey, do we have the right team to start that program?
What do you think is the one habit that the successful practices have that the ones that you've seen struggle don't have?
Systems is something that's big. Taking time to create the systems, and also editing the systems. I think a lot of people think that one time I can set up a system and everything's going to flow. It's not. It's going to change as you grow. You had 4 employees back then when you started the system. Now you have 20, or maybe you have 10, and things need to change. People need to have accountability through systems. I'm a big systems guy and a details person. So, what I like to do for our team is create different guidelines. And, just as today, I heard another step that we need to add in, another component, because we hit certain milestones. So every time you hit new milestones, you have to think of new challenges, whether you have them come right to your face or whether they're coming in the future. Prep for those solutions and prep for those systems. So if you are starting practice, let's just say you have 100 patients in your facility, that's going to change rapidly once you hit 125, 130, your teams. When you bring on a nurse practitioner, or maybe you want to bring on more nurses or some office manager, or maybe you're growing in the SNF market. All of these different things, you have to have systems. Every big company has systems, and they're constantly editing and improving their systems as time goes on.
Yeah, and then imagine having a new location. Now you're multi-location. You start to lose that like direct touch so quickly.
Yeah.
Those are great growing pains to have, but if you grow without the foundation underneath, it can just turn into complete chaos.
It can.
Is there anything I haven't asked you that you wanted to make sure we touched on before we wrapped up?
No, I would just say, listen, AI is out there. We don't use it fully in every one of our services, but I would be open to the changes with it. I would explore what you could have to make your life easier. There's a lot of things that can be automated and some things that shouldn't be automated, but I would be open to change and understand that this is coming whether you like it or not, but it really could be a benefit. And we're seeing benefits from a patient level. So think of a patient first before you do anything, you implement any service. Think of a patient first. How would the outcome be for them? And, I hope everybody got some value out of this podcast. Tim has a lot of great podcasts. So hopefully we're up there on this podcast. Thank you so much, Tim.
Yeah, this has been a good episode of lessons I think a lot of practices can put to work, whether it's how you message stuff, how you roll out change, where AI fits in, how you build a reputation off of all of that stuff. I think we touched on probably too many things to wrap our heads around in just 25 minutes or so. But why don't you tell everyone where they can find out more about you and Gabby Health?
Yeah, absolutely. You can go to gabbyhealth.ai. You can see a full breakdown of our services and how we're able to help your current communities. And even if you're a private practice or in the SNF or ALF world. Thank you guys so much.
Yeah. Listeners, if you want to build marketing that aligns with your operations and actually scales, check out our patient pipeline blueprint session offer. It's a workshop to uncover how you can attract new patients and convert more inquiries into appointments for your practice. Learn more at luminus.agency/blueprint, and don't forget to subscribe to Healthcare Marketing Edge on Spotify, Apple, or YouTube for more insights like this. See you on the next episode.